Welcome to Future Sense Now, where we explore the landscape and byways of our shared futures. An e-zine of the Futures Forum live online. We exchange ideas, information, and inspiration about the futures we want. Get Future Sense Now with host Dr. Claire Nelson, futurist and editor of Human Futures.
Greetings and welcome to Future Sense Now, an online e-magazine of the Futures Forum. April 7th is World Health Day, and here we are amidst the 100-year crisis, the global pandemic. And so we're having a series of conversations about healthcare futures with a particular focus on developing countries around the world. And my vision is to find out how do we continue to march forward in assuring health for all by the year 2030. Yes, I'm still focusing on Sustainable Development Goal number 3, which calls us to look at how do we provide universal health coverage and care to all people everywhere. And better care means improving overall quality by making healthcare more patient-centered, reliable, accessible, safe, and focused on achieving meaningful health outcomes. It also has to take into account economic and social inequalities, urbanization, threats to climate and the environment, and the burden of communicable diseases and other infection diseases, as well as what's emerging in some of these poor countries, chronic incommunicable diseases. So here we are, and we're going to have a conversation with Professor. Now, I'm going to speak Turkish, folks. Listen to me. Okay. Professor CENGIZ MORDENIZ.
Very good.
He is an associate professor of anesthesiology, internal intensive care, and pain medicine at the Namık Kemal University in Turkey. And more importantly, for our conversation, why I found him so fascinating, he's very much into alternative medicine and traditional medicine. He is a homeopath, he does cupping therapy, and therapy. I'll leave him to explain that. Now, Professor, how are you?
Thank you. Well, the epidemic showed us that the COVID virus doesn't eliminate rich or poor, or developed or less developed countries. And oppositely, rich countries, Europe, America, where there are more people infected and there are more deaths. So beside this, as you mentioned, in Africa, for example, malaria, the infectious disease, is still very important. 100,000 of dead people. For example, Uganda, 27% per year of the deaths are because of malaria.
Wow.
So on one side, the simple infection diseases, I'm saying simple because we know the cause, the pathogen, we have the therapy. For example, the COVID epidemic showed us that we don't know how to react. And just very simple hand washing, social isolation or social distance, these kind of things are commented. So this was a lesson for us that health should be equally in justice, be given to all the people. I mean, it's a natural and citizenship right for everyone. But
yeah, you know what I want? Yeah, I want to step back because before you continue on the detail, I want to step back and talk about 2030 and this idea for all. And my primary reason for reaching out to you is that I found that you were an expert, well, certainly been doing a lot of work around traditional medicine, alternative medicine. And I want to start there because I want to figure out, in your practice of homeopathy and cupping therapy and therapy, which I'm going to have you explain, these are all old traditional ways, right? How do you see let's say, them being a part of the future with healthcare for all, from your perspective as somebody who's a practitioner and a scientist?
Okay. As traditional medicine, the modern medicine in Africa, it's very clearly done. Modern medicine was imposed to the people, but it cost a lot, and people still, most people still go after traditional medicine. They feel more familiar, they easily reach to them, and the cost was less. What happened? The modern medicine for a long time ignored the traditional medicine and just took a part. And that's why they were called alternative medicine. But modern medicine remained inefficient in many diseases, or sometimes because of the resistance, drug resistance. So some of the conventional therapies became inefficient. And then what happened? Because of the social, economic, and some other reasons, World Health Organization, after 2002, decided to integrate or to accept the traditional medicine. And until that time, it was used to be called alternative medicine. So it was just one side, there was modern medicine, and the other side, alternative medicine. And doctors or health workers, they just seem not to see those traditional things. But from one side, most of the drugs were originated from those herbal medicines or herbs. Yeah. Anyway, after that, the name changed, and it's what called traditional and alternative medicine.
Yes.
Then there was another change because there was the effort to complement to the modern medicine. I mean, not to take it as alternative, but to use it when it was inefficient. Then why shouldn't we get help from the traditional medicine? And it was called traditional and complementary medicine.
Yes.
So it was just to complement to that.
Yes.
Still, one step further, in United States or in many other countries, now it's called integrated, traditional and integrated. So now the trend is not to take as different therapies, but one integral therapy. So depending on the patient, you could use all kind of those traditional methods. But there are still discussions about that, because as evidence-based medicine, the discussion is that those traditional methods, are they really evidenced with scientific methods? Their effect is just placebo effect, or do they really show some kind of concrete effect, and so on? But finally, World Health Organization, mainly for Africa, but also Far East countries, an action plan between 2014 till 2023. So in the coming 2 years, the idea is to integrate all the traditional methods, traditional medicine, into the modern medicine, and make them just one compact therapy method. For example, cancer, for also other diseases.
So let me ask you a question. So let me ask you a question then. So I think I get what you're saying. So now we're at the stage where by 2023, we're going to have a really integrative compact of both sides. So here's my question. We now have the ability, right, to do personalized precision medicine.
Yes.
Right?
Yes.
And that cost has come down.
Yeah.
Right? I mean, it's still expensive, but it's coming down. So therefore, one would think that there now is the opportunity to, quote unquote, do that testing to decide what is effective at the person's level. So do you combine surgery and chemotherapy with herbal treatments for cancer treatment, for example? I mean, do you think that given where we are in terms of technology and personalized medicine, certainly in the Western countries, if not in Africa, that we will soon see really the uptake of this new way of working, where quote unquote complementary naturopaths are working side by side with medical doctors to give you personalized treatment? Do you think that's
Yes.
really coming?
Yes, actually, traditional medicine is cheaper and less invasive. And
Yes.
the trend is towards non-invasive, holistic, and personalized medicine. I mean, epigenetics, so genomic approach, and so on. From one side, even though to that technology, just for headache, for example, the modern medicine is not able to relieve all the time the headache. And most people have this kind of pain and so on. And the medicines which are used, for example, analgesics, sometimes they increase the pain. They have side effects. They are chemical products. And because of not approaching as a whole the person, I mean, actually, there is no disease, but there is the patient. So if you don't approach in that way, each specialty gives certain drugs, and finally, the patient has so many drugs which have side effects. And on the other side, with drugs, we are not able to cure all the time. We just relieve the symptoms. And actually, we can talk about the future. It goes that chronic patients are in a way just classified with a certain disease, and usually they use lifelong medicine. Let's say you have your blood sugar certain level, or you are diabetes, and once you start, lifelong you will use the medicine. You have blood pressure high, you are hypertension patient, and you are not cured. You just take the medicine. Once you get the medicine, you relieve your symptom, but in a way you are lifelong addicted to that drug.
So let me ask you a question. Can either homeopathy or cupping therapy or Hiruva therapy address any of these issues? First of all, what is cupping therapy? I know what homeopathy is. What is cupping therapy, and what is Hiruva therapy?
In traditional way, for pain or some kind of complaints, they used to put glass cup and just fire in it, kind of vacuum, and they were putting on the skin with vacuuming effect and with heat to relieve pain. And later, I mean, even today in physical therapy, vacuum therapy, cupping therapy is used. Different type of cups, plastic, bamboo, so on, glasses. And cupping therapy, there are two types: dry cupping and wet cupping. In dry cupping, you just put the cup, and with vacuuming effects under the skin, the toxins which are accumulated, and actually we just discharge the toxins which we take from outside, or which are the end products of the metabolism of the body. We take them out from our breath, from urine, from feces, or from the skin. But sometimes if we take too much, or if we have certain metabolic problems and they are accumulated, so with vacuuming effect, we just pull them to the skin to take them off. In a way, it's kind of detox,
Gotcha.
detox, and
Gotcha.
weight therapy, or which is also called unanim therapy. Then you just make some just superficial superficial cuttings, and then you put the cup on it, and after the vacuuming, those toxins are pulled faster and easier because you just cut the skin superficially, and that's called wet cupping therapy. Hirudo is leech therapy. Leeches are very small animals, but they have in their secretion tens of different enzymes, natural enzymes. Each one has different effect, analgesic effect, anti-inflammatory effect, and so on. So wherever you put on that site, when the leech bites, it leaves his secretion. So in a way, you just give at once so many different medicines or enzymes which have effects, natural, and then it takes the blood. I mean, it's fed with the blood, and when it's fed, it leaves itself. So in a way, you just give natural enzymes to that place for their analgesic, anti-inflammatory, etc., those effects. There are certain scientific research to purify each enzyme and then make drugs out of it and use them.
So you find that, I mean, when I hear leech therapy, I was like, oh my God, that sounds like the 18th century. But are scientists looking at these therapies to see really, as you say, the impact on, given we can now test precisely what's in our blood, what's wrong with our blood, have they shown that these therapies are more effective, like in the modern sense of doing this in New York or in Istanbul where you are? I mean, or is it only for like poor countries? How is this being discussed?
No. I mean, traditional methods are very much used not only in underdeveloped countries, but even United States or Europe. They are used very much. Homeopathy or some others, that leech therapy also. The thing is, when we consider evidence-based therapy, most our doctors, they expect scientific articles and research, which are inefficient right now. I mean, it's just started. But from one side, as I said, for leech therapy, there are certain trials and so on, but it's not at the point that, yes, this is so, and we can use it as evidence with modern medicine. So there are still some lack of scientific research and so on. But I think that with coming years, more research will be done and so on. Of course, there's also the other side, that the health sector is now in the hands of the pharmaceutical and medical equipment companies. And pharmaceutical companies with their drugs, I mean, there are years when they developed one drug. So they want to dominate in the market. And for them, lifelong medicine-dependent patient as a client is part of the system.
Got you.
On the other side, traditional methods, you may cure the patient at once. I mean, you try to cure the patient. So that's why they do not support very much. There's also this kind of
but Dr. MORDENIZ, listen, shouldn't the World Health Organization, though, if we're talking about sustainable health for all. And every African country, every Asian village, every Pacific island has some bush. They have some bush, some practice, some herb that they've used for centuries. And as you rightly say, what has happened is that science has gone to these islands, have extracted these herbs, these bushes, etc., and gone and purified them and made them into drugs. And so the holistic impact of using them as a whole herb, has not been done. But should not the World Health Organizations, working with people like yourself, really be pushing out now? We're talking about 2020 to 23 as the first 3 years of the last 10-year sprint, right? We're
Yes.
now in a crisis. Should there not be, let's say, should this not be an opportunity then for groups like yours, which have been, publishing and trying to keep this conversation going, be able to amplify your voice to say, hey, we need support to have, the research done in the villages, in the cottage industry that we know about with these practitioners, so we can bring more evidence of the success of this with patients.
Of course, you are completely right. And World Health Organization, especially in Africa, for example, asks to all the countries to prepare an action plan for traditional medicine, which would fit in their health program to integrate to their health system. And of course, in this action plan, everything you're saying will be part of the system. Because now, as you're saying in the sustaining health, the idea is not anymore disease focused, but it's well-being,
yes,
prevention,
yes,
lifestyle,
yes,
higher the standards, living standards,
yes,
psychologically, physically, and so on,
yes,
and not to disease-oriented as the modern medicine was doing.
yes.
So what's going to be to do is the national action plan, which will be supported by the World Health Organization, higher the standard of the applicants. I mean, those, even though traditional methods should be, even the doctors would have special trainings and practice in a modern way. I mean, paying attention to the hygiene, the patient and so on,
Yes.
and observe if any complication or anything happens. Scientific research, training not just the health worker, but also people, because the future health system will be more from the hospital to the patient. Patient organized, telemedicine and so on. And in those things, for example, homeopathy would fit more, because you could just asking the person, and the person will be more responsible of his own health,
yes,
lifestyle.
yes,
He will follow those.
yes,
Some testing or some minor interventions could be done under the control at home. It will go to home. Just the hospital or those places will be just for invasive interventions and so on. Otherwise, just for routine testing or minor interventions could be done at home. And of course, monitoring will be more important, because the idea will be early detection,
yes,
early intervention,
yes,
and prevention. Those will be more important, because otherwise, right now, we are more oriented to the disease. Even the patient, when he has problems, he goes to or she goes to the hospital, so on. But there will be full monitoring, data collecting, and all your health system with other data will be followed and monitored, even genetically from childhood vaccines and so on. So it will be more toward prevention. And in that sense, higher standardized health workers who will practice and use traditional methods together in an integrated system with the modern medicine. So it will not be anymore as an alternative, but as a part of the health system with multi actors, we may say.
And it will probably, I'm thinking out loud because, you know, one of the things in Africa right now, there is a huge number of young people who are unemployed, right?
Yes.
But if you had an allied health, some kind of allied health certification, right?
Yes.
And some of these young people could be trained to modern standards in traditional and alternative medical procedures, then you can solve two problems. You can solve the problem of lack of health care and the problem of people not having work. So it'll be like a partnership between
very good intermediate health worker. So for this one, it will be better to leave to each nation to decide how to organize. But of course, World Health Organization or developed people and so on could help and support them. For example, for Africa, I'm sure many Africans who are working in USA or in Europe, they could voluntarily give those trainings, or people coming there, going there for certain periods to establish those systems. I mean, you are completely right.
So as you think about what's happening in Turkey and yourself being in a university, being in the professor business, so you can actually begin to change stuff for yourself, what role do you think a country like Turkey, that's like a middle income country, you are sort of between Europe and Africa, in that sense?
Well,
what role would you play in a project like this?
In Turkey, what happened? Our president directly supported traditional medicine, and Ministry of Health issued the permission. I mean, they selected 15 of those traditional practices in 2014, and they said only those universities, those trainers whom we fixed, they can give those trainings, and only doctors can participate to those training, and only doctors could perform things once they get those certificates. And once they get the certificate, they ask to the Ministry of Health, well, I will do those practices and so on. They get official permission. And now Ministry of Health also supports university hospitals or state hospitals to make those kind of branches within the hospital. There are still resistances from our colleagues or so on, but we also, a few months ago, we established as a center. Beside me, there is hypnosis, ozone therapy, and so on. It's a center. But as a homeopath, it's about a year. I mean, I'm a homeopath for 5 years, but I could only start to practice last year. So it's only 5 years that the ministry tries to control, standardize those traditional methods, and tries to integrate into the health system. But of course, I haven't mentioned, there is the economical things. For example, Social Security doesn't pay the traditional medicine. So the patient has to pay directly. I mean, the financial thing is also another thing. That's why I said, if each nation tries to organize within his health sector, so they have to use and decide how will be the financing and how will be the personal training standard. So within those coming years, they have to organize all those things to integrate into the modern medicine, because World Health Organization is supporting this.
Yeah, well, as we come to a close, are you optimistic, pessimistic? Are you neutralistic? How are you feeling about the pace of change? Because there's a big piece you just hit there. Insurance isn't covering it. How do you feel about the pace of change? Do you think that this pandemic is going to create more focus on healthcare, and therefore we're going to see things speed up in the healthcare space?
I'm always optimistic, because as long as there is human being, in the history, there were wars, pandemics, epidemics, diseases, and so on. But the human being has survived and still does. So in the history, there are certain periods where those wars or pandemics, of course, destroys. But reminded us that very simple hygienic rules. I mean, washing hands, being more careful, making around cleaning, and in the relations to pay attention. And then the labs, they are trying to make new vaccines. For example, malaria medicine, chloroquine, has been found useful also for COVID. There are vaccine therapy and so on. Of course, such a big pandemic will change not only health system, but the global system. Health system will be part of this. So it will be social effect, economical effect, and even the patient-doctor relation, financing of the system, they will all change. We will see those changes, and this COVID endemia will push with a more accelerated change of whole system. I mean, economical system, financing, and of course, health system also will change, approach drugs. As I said, it will go more patient-oriented. I mean, it will be, the expenses will be less also, because the hospital fees and so on, other. It will be also economical constraint. It will be more patient focused, telemedicine, and more digital things. Because in a way, what happens, even now, when you go to the hospital, what happens? You talk with the doctor, he or she asks you to get lab findings, images, and then you are like an virtual identity. And on the table, there are your lab data, images, your complaints, not even talking with you. That's also one difference between traditional, and people feel more familiar. Because here the doctor just approaches you, apart from you, as a virtual identity, your lab, your problems, and so on. And then you are entitled with a certain disease, discriminated. You are so, and this is your therapy, this drug, you go and get your drug. But human being is a social, psychobiological person. I mean, there is the psychological relation, somatic diseases, and then energy medicine, because actually we all have electromagnetic field around us. And in medicine, we just take, or we just consider the somatic body. And psychological part, we leave it to psychiatry or psychology. But the person, human being, is whole. And we need to approach, and then energy medicine will be more efficient. For example, also non-invasive methods, let's say light therapy, frequency therapy, it will be non-invasive early detection. And when the light, for example, right now, hyperspectral method, it's like the fingerprint.
Yes.
Each thing has a different electromagnetic signature, spectral signature. So I believe that right now the light can be divided in 500, 600 waves. When it will be, let's say, 5,000 waves, then with light photons, we will be able to directly see all the body at the energy level and modify and therapy without the drugs in the future.
There's a lot. I really like this approach. I mean, I really like hearing these new ideas, light therapy, frequency therapy, homeopathy, the whole shebang. One likes final question as you look at 2030 then, and you think about your own practice. You're a professor, and you actually are working to teach people about pain medicine. You're also a practitioner. How do you see, if you have to look at Turkey in 2030 and look at what will be happening then, what is an aspiration you have for the practice of traditional / inclusive patient-centered medicine? What does that headline look like in your own country?
Well, actually, people were inclined to go after traditional medicine. They were still going, but they were not pronouncing that. So now it's open, it's controlled, standard, so they can easily come, and it's part of the integration. But there is still resistance from our colleagues, pharmaceutical companies, so it's not easy.
Until they figure out how to make money, right?
It's a transition period. I mean, more research will be done, the doctors will do it, and so on. I think that it will be integrated. And about the health system, so as I'm saying, prevention and wellness will be more important. And for that one, traditional methods might be also popular among people, not only underdeveloped countries, but also in the developed countries. So this epidemic or pandemic, I'm sure will make big change in the health system also, because there was privatization, financing, pharmaceutical companies, and so on. But this system, I think, will not go more in this way. There will be more, I mean, patient-related to approach holistically and take care of the person, and the person will be more aware of his own health, proper health. It will follow, and the technology, telemedicine, new technologies would ease the diagnosis, monitoring, and so on. And traditional methods, I hope it will be as an evidence-based medicine, will take part of the modern medicine.
Right, I think that's a good thing. So we leave it right there. Thank you so much.
2030
traditional medicine / will be part of standard medicine. What do we call it? Traditional, alternative, complementary medicine.
Complementary, not anymore alternative.
Complementary
or integrative.
Complementary and integrative medicine will be the standard for 2030, and we leave it right there. There's a lot to learn, a lot in this crisis. I want to thank Professor CENGIZ MORDENIZ, who is the Associate Professor of Anesthesiology, Intensive Care and Pain Medicine at the Namik Kemal University in Istanbul, Turkey. Thank you so much for joining us. Friends, I'm so happy to be meeting people from all over the world. We want to thank you for joining us on Future Sense Now. Futures Forum Live Online, where we explore salient futures and salient ideas. Remember, the future is embedded in the landscape of today, so we're going to go out and co-create a better future and a future of well-being for all. And as we say in Jamaica, until next time, safe journeys and walk good.
Thank you. I thank you.
Thank you for listening to Future Sense Now with Dr. Claire Nelson. Future Sense Now is produced by the Futures Forum in Washington, D.C. For more information, visit www.thefuturesforum.org. Remember, our futures are embedded in the landscape of our present stories. Seize the day, share this story, and share the future.